Welcome back to my channel. This is Maternal Newborn Education with your girl Jazz. Oops, that's me. Okay, today's video we're going to be talking about cold and flu remedies. This is flu season, the peak of flu season. Everyone has already gathered after the holidays, and who's feeling sick? I'm not, but are you? Today we're going to be talking about natural remedies and medication usage for cold and flu-like symptoms. Let's start with natural remedies. So if you have a cold or flu-like symptoms, you're under the weather, exhibiting a fever, chest congestion, nasal congestion, all of those things, it could be one symptom or it could be many symptoms, but you yourself are breastfeeding or pregnant, start with natural remedies to see if they minimize your symptoms. I am not going to say that they will cure your symptoms, but minimization so that you can function throughout the rest of your day. Top spot is going to be water. You cannot carry on throughout your day if you are dehydrated. That is important for you yourself, but also important for baby and breast milk production. Think about dehydration. Your body is going to take fluids from other areas. So if you're producing milk, it's going to pull those resources to conserve your own life, right? And so everything else is not going to be sustained very well. The problem is when you're sick and not feeling well, oftentimes you don't have the energy or the mental capacity to remind yourself, hey, I need to drink something every hour on the hour to consistently rehydrate myself. It can be warm water. So sometimes I suggest to clients or patients that they should drink a hot cup of water with lemon or without, because me personally, I cannot do the lemon, and honey. So the warm water will soothe that throat, but then also it will make sure you're getting your water intake in. Sometimes I'll say do a 1-to-2 ratio, right? So if you're going to do a cup of warm water with honey and lemon, go ahead and make sure you're drinking 2 cups of water following that, because I want to get the water intake up there. Let's get it through the roof. The use of a humidifier can be helpful to make sure that your environment is not dry. So your nasal passages are being humidified. Your throat is also being humidified. You're not breathing in very harsh, dry air. Vitamin C. Get your vitamin C in. Get your vitamin C in. So this can be in a supplement tablet. So I'm talking about multivitamins. Typically that's something you're already consuming. Multivitamins, you can take it in pill form, liquid form, it really doesn't matter, but making sure your immune system is boosted up as much as you can from all areas. So water, vitamin C. This is a special one that I personally like, garlic. Garlic is good for you, and whether you can tolerate garlic in I really wouldn't say foods, because that's easy to do, but having maybe garlic tea. It sounds nasty, but you can sweeten it with some lemon. You can add, an additional tea bag, something like that. But I would prefer dicing up actual garlic and making boiling water and making tea out of that. Garlic is really good for you. This is going to help your immune system fight off the bacteria that you kind of have brewing within your system. Another cool option is boiling water and using that as almost a steam treatment with a towel over your head. That is just going to open up your nasal passage. I really would recommend putting in some essential oils into the water, something like a peppermint. You can do a lavender if that helps and make it smell better, but something that's going to help open up the airway and give you some sort of relief. I do like to blow my nose before and after, so that way, especially after, because you're going to have a lot of drainage, and so getting all that excess out of your body. Don't swallow your mucus. If you think about it, your mucus is essentially your leftover. It's your body's way of getting rid of germs. You swallowing it, it's like, although it's going through your stomach passage, it's like consuming bad leftovers. It's your body's way of ridding itself of the germs. So get it out of your system and into the trash can, toilet, sink, wherever. down the drain. So talking about essential oils, I have two things that I really like to do. So I have something here. It's called Queasies. This is typically used for nausea, but sometimes I do like to use these for congestion and stuff like that. I'm gonna show you what it looks like. This here is going to be the clip. So you clip this onto your clothing like so, and this part is going to be the essential oil portion. Now if I were to wear this, unfortunately I have a turtleneck on, I could clip this onto my clothing like so, and now I can smell the Queasies whenever I want to. In the Queasies, it contains lavender, peppermint, spearmint, and ginger. It smells really great. I like to use the Queasies when I'm not feeling all that great, or I just don't have any essential oils, and I can just clip this to my clothing and then I'm good to go. It follows me wherever I go. Now let's talk about regular essential oils. This is just from a packet that I have. This is spearmint. Oftentimes take this, put it on a cotton ball, and kind of keep it near you. So I never put essential oils directly to the skin unless I buy the type of essential oils that can be applied to the skin. This I would lay around the house on cotton balls, or dilute in some water and put it in a humidifier and have it going into the air. It works wonders. Another natural remedy you can use is salt water. I like to gargle with salt water. Sometimes I will hold my head back and put salt water down my nose and then out through my mouth. It helps to soothe the nasal passage and remove any drainage that you may already have sitting there and bacteria that's just collecting, and open up that airway. Do not apply vapor rub or Vicks directly to the skin where baby may consume or come into direct contact with it. This can result in breathing issues for baby. Also, it can result in skin issues. So keep that away. Anything that's topical, I really wouldn't recommend. You can use vapor rub on your own nose, but like I said, if it's coming into contact with baby, you would not want that. Now that we've gone through a few of the natural remedies, let's recap. We said hot water, so whether that is a steam treatment or drinking a cup of hot water with lemon or honey. We also suggested the use of essential oils around the house, either in form of a Queasies or in form of cotton balls placed around the house in a humidifier, something like that. We also suggested using salt water, gargling with salt water or apple cider vinegar, and I believe the last one we talked about was garlic. So let's move on to medication remedies. If you're going to use medications to help with your cold and flu symptoms, it is better to use short-acting drugs, so things that last for 6 hours or less, versus things that last for 12 hours. That means long-acting medications typically stay in your system longer, which means baby is going to have a higher consumption throughout the half-life of the medication, okay? Layman's terms, the longer the drug stays in your system, the more exposure the baby may get. Right? Simple. Do not combine medications, so do not take multiple forms of medications at once. Meaning, be very cautious about what type of medication you take, how often you're taking, and the active ingredients in the medication, because you do not want to take two different types of cold remedy medications that have the same type of drug in it, because that can be considered a large dose. You can use nasal sprays. They are less likely to affect the breast milk in ways of drying it up, also in ways of transfer to baby. Consider using nasal spray over oral medication when possible. The transfer of medication into your breast milk is at a lower percentage than oral medications that you would naturally consume by mouth, okay? You can try oral throat sprays, so like some of that numbing spray, that is also considered safe because of the lower risk of medications getting into your breast milk. And then let's talk about oral medication. So cough syrup, Robitussin is okay within reason. Please do not overuse Robitussin because the medication dosage is going to be calculated over time. So use it as prescribed. You do want to check the active ingredient in the medication. Active ingredients such as pseudoephedrine and phenylephrine are generally considered to be safe for the breastfeeding baby, but pseudoephedrine may reduce milk supply. According to Thomas Hales, PhD, breastfeeding pharmacologist, notes that breastfeeding mothers with poor or marginal milk production should be exceedingly cautious in using pseudoephedrine. It is apparent that mothers in late-stage lactation may be more sensitive to pseudoephedrine and have greater loss in milk production. If you're going to take some cough medicine or pill form of this type of medication, try to use it sparingly. Add that in between other natural remedies, not consistent back-to-back usage. In a mom that may have overproduction, I do not consider her milk would drop drastically just by taking a couple of doses over the next 3 to 7 days. But a mom that already has a milk supply issue, it is considered a higher risk for milk supply. Medications that has diphenhydramine or Benadryl. Antihistamines dry up your secretion. So breast milk is technically a secretion that comes from a gland. If we dry up all the glands, think about considering my milk supply is produced by glands. And so if I am drying up my nasal passages, it could potentially dry up my milk supply also. One dose is okay in moderation. Multiple doses, you can see a change. And I would just pay attention to your milk supply, noting if you are starting to see a drop in your milk supply, consider stopping the medication and doing other things to increase your milk production. Motrin and Tylenol are considered safe for breastfeeding, so you can also use that if you are having a headache, if you're having muscle ache, muscle soreness, if you have a fever, if you are having excessive swelling or inflammation. Those medications can be used and are compatible with breastfeeding. Antihistamines are also used to treat cold-like symptoms. I would encourage a mom to go for something like Claritin over Benadryl just because of the sedative nature of Benadryl. The idea is that baby could potentially get some of the effects of it and make them a little bit drowsy. I do not think one dose of Benadryl will be enough to cause baby to have sedative-like symptoms, but in the event of it building up, so multiple doses, it can potentially be a side effect. I would stray away from Allegra D or Claritin D because of the decongestant portion to that. If you are noticing that your milk supply is dropping off, I would consider scaling back on the medication use and then doing things to stimulate the breast to continue to produce milk. So feeding regularly, using heat to stimulate the breast before a feeding. Also consider adding pumping to the mixture. So feed baby and then pump after, so that you are kind of telling your breast that we need to produce a little bit more. Trying this over a period of time. This is not a one-time feeding session and then your milk supply increases. Same way, this is not a one-time you take medication and all of a sudden the next feed you have no milk. This is usually gradual over time. So consider the combination of the two, starting with natural remedies and potentially adding medications on top and alternating between the two of them. If you have any questions or concerns, I always advise you to talk to your medical doctor or professional. I am giving you advice based off of breastfeeding compatibility and the risk of the use of medication while breastfeeding. Your doctor is going to be the one to verify or give you potential benefits of using the medication or not using the medication. If you have any questions about specific medication usage, please talk to your doctor first. Also, I always recommend keeping a breastfeeding journal, so when you take the medication, what effects you've noticed in your breast milk. And if you don't think this is going to be appropriate to use the medication, store your milk. Whatever you do, store your milk. So continue to stimulate the breast, pump, and store your milk until you have confirmation to your liking. This is maternal, newborn, and breastfeeding education with your girl Jazz. Oops, that's me. Take care and feel better.